Morning, all.
Good morning.
Right. Good morning.
Good morning, everybody.
Morning.
Looks like we're missing Commissioner Anderson.
Well, yeah, we're missing Commissioner Anderson and I believe also Mayor Byers. I'll start giving him a call.
Thank you, Victoria. Thank you for your patience.
Oh, thank you for your patience. I think there were some technical difficulties, but that should be addressed, and we'll have the members on soon. Thank you.
Good morning. Good morning, Commissioner Anderson. Everyone is present. You're on mute.
Commissioner, we've got you on mute, sir. Commissioner Anderson, you're still on mute.
Yeah,
Thank you.
Victoria, would you contact Mayor Byers? I think she was, we were talking earlier and I think we discovered we were on the wrong.
I'm on.
Oh, there you
You
are.
both are on.
Okay.
All right, good. All right. Do we have a quorum?
Yes.
Yes.
Oh, good. Okay. I'll call the meeting to order then. And the first thing we're going to do is go into executive session.
Do we need a motion for that?
Correct.
So I move that we go into executive session
All right.
regarding the review of a public employee.
Is there a second to that?
Second that. Commissioner Lindy.
Okay, thank you. So it's been moved and seconded. All in favor?
Aye.
Okay. So it's been moved and seconded and approved to move into a second executive session. So we will move into executive session and please, if you're not involved, please sign off for right now.
Do we
No.
need to state how long we'll be in executive
Oh,
session?
that's right.
Correct.
I would make an amendment to my motion to state that we'll be in executive session for, I don't have an expectation. Somebody want to help me out here?
15 minutes, 20 minutes?
For up to, I'll say up to 30, we can come back anytime.
Okay.
And actually, Commissioner, there's another link that those people that are going to executive session will go to, and everyone else can stay on this, on this link.
Yep. Okay.
Thank you.
Okay. See everybody on the other side.
Come in.
Are you on mute?
No.
Good morning. I wanted to share that the board has decided to extend for an additional 15 minutes the executive session. So I anticipate their return at 9:24.
Thank you.
Thank you.
Thank you all for being patient. We are back. We are now back into our regular board meeting. And so we will continue our agenda on item 3. Mr. Ibach, if you would do introductions of guests and staff.
Yes, Commissioner Anderson,
Here.
Dr. Clary. Okay, Commissioner McKinney,
Present.
Commissioner Lindy,
Present.
Mayor Byers.
She's not on the meeting yet.
Okay. Councilmember Duval,
Present.
Dr. Atterbury,
Present.
Dr. Clary.
He's joining now.
Okay. All right, Dr. Clary.
Here.
All right, Mayor Byers. Are you there?
She's still not on yet.
Okay, we'll go back to her. Health District staff, Andre Fresco.
Here, good morning.
All right, myself, Ryan Ibach, Chase Porter,
Morning.
Melissa Sixberry. Melissa,
It appears even though she's unmuted, her audio is not working.
okay. Lillian Bravo,
Here.
Sean Mcgee,
Here, good morning.
Dr. Bard,
Here.
Jocelyn Castillo,
Here.
Victoria Reyes,
Here.
James Elliott,
Good morning.
all right, Jackie Bobeck, Environmental Health Specialist,
Here.
Brenda Encinas, Accountant,
Here.
okay, and Mayor Byers.
She's had some difficulties with her internet earlier, so she may still be experiencing that.
Okay.
I'm on. I'm just trying to get my
Oh.
camera to reverse.
Okay.
All right, and then we do have 2 recently hired staff that we'd like to introduce. So Chase, can you introduce Brenda?
Yes, I would like to introduce Brenda. She's been with us a couple of months now. She's coming into our HR payroll department right in the middle of open enrollment. So she has got her work cut out for her, this thing. So I'm really appreciative for her to come on. Brenda, can you maybe say a few words about yourself, please?
Well, nice to meet everybody this morning. I'm really excited to be a part of the team. And yes, as Chase said, I've come into a big role, but I'm really excited to be a part of the team. And I recently just came from Yakima County Clerk's Office, actually worked in the jury office for 3.5 years. But my background is in the medical field with HR. So I'm really excited to be back in the HR field. And then I also do procurement here as well. So really glad to be a part here and thanks for having me.
Thank you, Brenda.
Okay, and Sean, can you introduce Jackie?
Yes, Jackie Bobeck is our newest hire for environmental health specialist. She started on November 1st. So Jackie, do you want to say a few words?
Yeah, hi everybody. I'm really excited to be here. My background's in biology, so I'm really excited to use that and help everyone as best I can since I've been local my whole life. So I'm excited to finally do something for the community that I grew up with.
Well, welcome aboard to both of you.
Thank you.
Welcome.
Next, we will move on to review of submitted public written comments. Mr. Ibach.
Okay, we did receive 1 written comment, and so I will read that in full. And it comes from Kate Pregaman. I am the parent of a Yakima School District kindergartner who just got her first vaccine dose in November, and we are very excited and eager to see more vaccination among her peers. I'm writing to advocate for adopting COVID policies in schools that recognize the game-changing ability to vaccine the 5 and up age group. Right now, Yakima School District policy developed with YHD, as I understand it, asks all students experiencing a symptom, regardless of vaccination status, to wait 5 days before testing and wait 10 days if they have been in contact with someone with COVID. That's a lot of missed school for our children, and to my mind doesn't reflect the opportunity provided by vaccination and the public health guidance recently released for schools by the Washington State Department of Health in late October. I believe our school district adopted the policy outlined here from the State Department of Health, and then she gives a link, which eliminates the need for asymptomatic vaccinated students to quarantine after a contact. It would be a carrot that could entice more hesitant parents to choose vaccination for their families, which would benefit our entire community, as well as reducing school interruptions for their own children. Also, this policy would allow all students experiencing symptoms to test to get back to the classroom sooner if they don't have COVID, which I believe most parents would welcome. I want to thank the Yakima Health District for their work to keep our community safe and up to date with the best information available regarding protecting our children, COVID, and keeping our schools open. I believe the next step is a policy that takes vaccination status into account and eliminates the waiting period before testing symptomatic students. So I support aligning local policy with the state's guidance as I cited above. Thank you for your time.
Thank you very much.
I'd like to address that if my audio is working now. Is my audio, can you all hear me?
Yes.
Okay, perfect, thank you. So I can address that public comment. The Yakima School District decided on their own to implement stricter policies regarding quarantining, regardless of vaccination status on their students because of the high transmission in the community. We meet with them regularly, and yesterday they informed us that they are going back, now that we're under 300 cases per 100,000, they are going to be going back to following the guidelines as they are written with Department of Health. So those guidelines will be changing.
Thank you.
If I could interject, appreciate Melissa's comments there. And of course, this varies by, from district to district throughout the county. One of the things that I looked at that letter that was submitted, and I looked at she had attached a link to a decision tree from the Department of Health, and I thought it was interesting. It did mention, that if people that were in contact were asymptomatic, and it gave an allowance to allow kids to remain in school if they were vaccinated, but also allowed it if they had active immunity from actually being exposed and having COVID within the last 3 months. And I thought that was good to acknowledge both of those because in both ways you do acquire immunity, whether it's vaccination or by contracting the disease. That's all.
I would echo Commissioner Lindy's perspective. That was mine as well. That has been lacking on a national level in the United States is an acknowledgement of natural immunity. So it's really nice to see that we're catching up with reality of natural immunity. So I look forward to seeing more of that and more extensive policy changes in the state that reflects that as well.
Any further comments? Okay, well, hearing none, we will move on to consent agenda. There's 3 items on our consent agenda to be considered today. And I will look for a motion.
This Mayor Byers move to accept consent agenda.
I would, Commissioner Lindy.
Was that you, Commissioner Lindy?
Yes.
Okay, it's been moved and seconded to approve the consent agenda. Mr. Ibach, would you take a poll, please?
Yes. So approval for the consent agenda, if you approve, state yes. If not, state no. Dr. Clary?
Yes.
Commissioner McKinney?
Yes.
Mr. Lindy?
Yes.
Mayor Byers?
Yes.
Councilmember Duval?
Yes.
Dr. Atterbury?
Yes.
And Commissioner Anderson?
Yes.
The vote 7-0.
Thank you much. Appreciate it. Now we'll move on to board business number 6 with Director Fresco.
Yes, good morning, everyone. Thank you, Commissioner Anderson. Welcome to the board and good morning to the public. I wanted to discuss realities of where COVID-19. Since we last met, we now have the official awareness of a new variant, Omicron, and that is certainly concerning for us. I wanted to share where we're at in terms of our county first. rather than focused on the potential for a new variant in our community, if you will. Our goal from the beginning with our work with COVID was to be response ready and vigilant in the defense of the health of our community. And that's something that we've really strived for from the beginning. So we created structures that were in place to ensure that people had access to the things that they wish to have. So we continue to have testing readily available in our community with our partners. We continue to have vaccination opportunities available with our partners. And fortunately, and you'll hear more of this from staff, that we are in a good place financially with funding really guaranteed through the first quarter of the next fiscal year. So that was something that was of concern to us. I want to share with you again that this is an expensive endeavor. We expected the state and the federal government to invest in us and being able to support our community, and that's something we've done. So first and foremost, we remain committed to serving the community, and our main focus right now is the Delta variant. The good news is that we have seen reductions in cases, and even though the numbers are still high in emergency rooms, they're not nearly as high as they were. So there has been a reduction. I will say that we remain cautious because we are moving into the winter months, people more indoors. I think the colder it gets, the more people will spend time indoors, and there's the opportunity for more transmission. And we do have this new variant. And I do not for a second view myself as an expert in these virologies. This is not my area of expertise, so I will defer to others. But I will share what I know. The first is that there is a new variant that has been found in other countries. It is quickly being found and spreading, if you will. The assumption is that it's not just spreading, but it has been present in other countries for a while. This is the reality of international travel, and with the easing of restrictions and certainly more people traveling for business and pleasure, there's the opportunity for increased transmission. And I do want to share the reality that there are many countries where vaccination is almost non-existent because they haven't had access to vaccines. So there is potential for the choices made in other countries and by people around the world to impact the United States. Our goal is to ensure the safety and well-being of the residents and those in our county currently, but it does impact us when we have travel like this. So we anticipate cases at some point. I will share with you that there's no way to define what those cases will look like. I think it's unclear the severity of this new strain. It's unclear how the vaccines that we have will keep people safe. I think that all has yet to be determined. So I wanted to prepare all of you for a time of anxiety and also tremendous just-in-time sharing of information. I think that we will have regular updates, and I think that as we get updates, they will be quickly replenished by new information. So I'm asking for your patience on this because we just don't know yet what this will do. My hope is that this will be a very mild form. My hope is that it won't impact our community, but we, again, remain vigilant and response ready to address that. So we have structures in place for vaccination. We have structures in place for testing. We have strong relationships with our partners in medicine to prepare for this if it happens, but that's what we know. So happy to entertain questions, or if there's anything from other members of the team here that would like to share anything, please do so.
Any questions?
My question would be for Dr. Bard, and he may or may not know this yet, but my understanding is that the Omicron variant has over 30 mutations in the spike protein, and that is one of those mutations is located right where it docks to the cells to get into the cells. And my question is there a thought out there that that might grossly mitigate the transmissibility of Omicron in comparison to Delta?
So, Dr. Atterbury, you mean infection in the cell regard to vaccine protection or actual ease with going from person to person?
Ease with going person to person, the virus docking and infecting people.
You know, I don't even think they know yet how good the vaccine is. There's a variety of opinion, but I think this will be clarified fairly soon. And I don't know for a fact what exactly enhances transmissibility or not. It may be replication rate, it may be attachment to human cells. I can't answer with any definitive comments.
Dr. Barg, can you tell us that the preliminary, as Director Fresco said, we don't know yet, they're still looking at it, but preliminarily it appears that the Omicron variant causes much more mild symptoms than even the original variant. For example, no loss of taste, much lower, in fact, insignificant rates of hospitalization so far.
Well, we'll see as it spreads and it affects more people. It'd be great if that turns out to be true. I just think we're too early in it to know what the variability is in the response to being infected. Of course, it would be great if it wasn't as virulent.
So could you comment on what they've seen in South Africa so far, which is that the doctor who found the variant and tracked it and notified the South African government, and WHO, that so far they've said that the symptoms are less symptomatic, it is less severe of a virus version than the original or the Delta?
I'm not sure how I can answer that. I mean, that's their observation. I think that's great.
So you haven't read any reports or scientific journals that have stated this?
No, I haven't.
Well, I'd be happy to provide some for our next meeting for review.
As long as they're in peer-reviewed journals, I'd be glad to read them.
Absolutely. I think the one I read was the British Medicine Journal.
That's
Excuse
good.
me, British Medical Journal.
Yeah, that'd be fine.
Commissioner McKinney, you bring up an interesting point. One thing that is different now from past spread of other versions of this illness is that there is an opportunity for people to voluntarily share that something's happening in their community or their country more quickly. So that is a positive from this, and that is that we understand what this might be or might look like. And so I think that the medical scientific community is more prepared to respond quickly. I would share that we have a very strong system of observation and reviewing this information in the state. And so my understanding is that the State Department of Health is well prepared to ensure that if it does come here, they'll be able to sequence it and determine, one, it being here, and two, its severity. I do think it's too early to tell how that will impact us. But again, I will share that it's been our experience that if people are unvaccinated and living in close quarters, or who are, as we refer here in this country, as essential workers, there's the opportunity for increased spread, which we may see.
You mean unvaccinated and without also natural immunity?
Well, I can't determine whether someone does or doesn't have natural immunity, and I can't determine that. I do understand your point that having natural immunity means that there is the opportunity to be more protected, but how you define that or who has it, it's more complicated than that.
I'd also add last Friday, there was a meeting of most of the health officers with the DOH, so that the chain of information is very short, and we'll be made aware of things very quickly when important information is available.
So happy to entertain any other questions.
Any further questions?
Okay, thank you.
Hearing none, we will move on to Mr. Chase Porter and his report.
Well, good morning, everyone. The financial report starts on page 18. We're going to do a little bit differently. We're going to do the cash flow first and then get into the reports. But before we get into that, I would like to mention, Andre touched on it briefly, but our FEMA funding has been renewed for up until April 1st, 2022. So excellent news that we're going to have plenty of funding for any vaccination activities that we're trying to do here. The federal funding will be there. So that was good news that we found out about that a week or so ago. And so that's sets us up well for the first quarter of 2022. Getting into our monthly report for October, at the end of October, you see there's an uptick in cash and cash equivalents. And we discussed that a little bit last month that, the initial investment for the mobile vaccinations went out at the end of September. And as you can see, there's a recoup of that initial investment at first. And we're starting to kind of get that. There's always a timing issue with that as we receive the bill and as we send the, as we submit the for reimbursement from Department of Health. And so there's always a little bit of a timing, will be a little bit of a lag. But that's why we're seeing an uptick in this month. And we'll see another major uptick in January as our federal funding or our state shared revenue is deposited. Next slide, please. Unless there's any questions, is there any questions regarding the cash flow? Good. So for the month of October, we had an approximately $80,000 gain in excess revenue, bringing it to $353,000 on the year. On just the summary sheet, I just would like to point out our total actual revenue at 11.1 million and our total expenditures at 10.7. So there's been some major transactions flowing through the health district as we support the fight for COVID. Next page, please. Moving back into this income statement, it's very similar to what we've been looking at all year long. Again, looking at 11.1 in actual revenue, 6.8 million coming down from the federal government. So that's a large chunk of change. Let me scroll down a little bit to the next page, please. So with 2 months remaining, we're looking at our budgeted through 2021. So we have a budgeted 14.5 million, closer to 14.6 million through the end of 2021. Currently, through the end of October, we spend 10.8 million approximately. So we have just under 4 million in remaining monies for the rest of the year, which is actually pretty tight for our budget. Looking at projecting kind of like a high $1.5 million a month. So for November and December, $3 million. And so we'll have a cushion of about $800,000, roughly speaking. So that's kind of looking at that year-end 2021 budget amount. We're keeping a very close eye on that. As long as there's not a major uptick in spending this next month, if something crazy doesn't happen, we should be underneath budget and not have to worry about another session to increase the budget for 2021. Is there any questions regarding that?
I would add, if I may, Chase, my appreciation to the board for allowing us to have a mid-year budget amendment, which allowed us to remain within budget, which was very necessary. Thank you.
Yes, thank you very much. As you can all see, that was needed. Otherwise, we would be handicapped by the end of by the end of August. We would be really limited in what we could do. Any other questions? Any questions regarding that? Moving into the program, I'm just going to kind of go through these. There's nothing significant of really to notice that is different this month. Can you scroll out just a slightly little bit? There we go. Still a lot of COVID programs. And keep on moving down, please. Is there any questions regarding the program specific or anything you guys would like me to touch upon? Okay, last page, please. So here's looking at our COVID expenditures through October. You can see here for the federal funding that we've had for this, it's $6 million with a payroll expense over $1 million and professional services other at 4.3 million. So this has been an expensive fight, but much needed, and all the funding has been there. Is there any questions regarding the financial report for October? Okay, thank you.
Thank you. is there a motion to approve the report?
I move to approve the financial report as presented. This is Nyla Duval.
Mayor Byers, I'll second.
Been moved and seconded to approve the budget as a report as presented. Any further discussion? I would just like to say, Chase, great job continuing as you always, and keep up the good work.
Thank you.
With no further comments, all those in favor, if you would take a poll, Mr. Ibach, I'd appreciate it.
Yes, if you're in favor of the financial report, please state yes. If not, state no. Dr. Cleary?
Yes.
McKinney?
Yes.
Commissioner Lindy?
Yes.
Mayor Byers?
Yes.
Councilmember Duval?
Yes.
Dr. Atterbury?
Yes.
Commissioner Anderson?
Yes.
The vote is 7-0.
Thank you very much. Appreciate it. We'll now move on to department reports. And first up is Chief Operating Officer Ryan Ibach.
Okay. Nathan is not at work today, so I will be giving the report on testing sites and vaccinations. So the first thing on testing sites, the University of Washington lab has committed to extending the 2 testing sites, the one in Sunnyside and one at the Yakima Valley College, beyond the end of this year. So the Sunnyside site, they have committed through April of next year as needed. And the Yakima Valley College site has been extended through the summer of 2022. Of course, if there's not testing needed, then we won't continue it. But as there is need, we'll continue those 2 sites. And of course, we work closely with the university lab and our partners to help these sites flow as effective and efficient as possible. On the vaccines, FEMA vaccines, as I mentioned before, are continuing to be funded through April 1st of next year, which will allow us to continue to support the vaccine efforts and not using local funds, but we'll be using federal funds. We also continue to work with Columbia Safety to make sure that we are running those vaccine mobile sites as efficient and effectively as possible. FEMA ran the vaccination sites at the Sundome for a couple months this spring, and then after they left, then the State Department of Health took that over until August 29th. And then the Yakima Health District took that over on August 30th, and we're working with Columbia Safety to provide those vaccines. We do continue to work with Columbia Safety to make sure that we are operating in a cost-effective manner. So when we took over the first 2 weeks on August 30th through September 12th, the cost per dose was $412. And as we continue to work with Columbia Safety and the number of shots, vaccines that we're giving this last 2-week period, November 8th through November 21st, it was $254 per vaccine. And so we will continue to look at ways that we can save money, and then we do meet on a regular basis to decide, what the needs are of the community and make assessments. Any questions on testing and vaccines?
I would just like to say thank you to you, but Nathan, even though he's not here, because I know he worked hard on that, and it's nice that we're able to now quantify that and we can kind of start to really measure it now that we know how to do so. So I just please pass on my thanks to him for that.
Absolutely.
Thank you.
Any other questions?
So go ahead.
Okay. Did you have something, Commissioner?
So are we ready for Dr. Barg?
Oh, I'm sorry. I got a couple more things I'll add. Just real quick, we before COVID, we were doing what Yakima Health District spotlights, where we would highlight a different program that we do at the Yakima Health District. And it's important that we educate the board, educate the public on other programs that the Yakima Health District does, and what it is that we do in those programs and the value to the community. So we'll start that up at our regular meetings in January. And so every month we'll have a different program that we will highlight. And then we also are advertising for an environmental health specialist position, which closes this Sunday, December 5th. So if you know anyone that's in the environmental health field or interested in it, please send them our way. And then also Melissa is working with the coroner, Jim Curtis, for a presentation on cause of deaths in Yakima County. So hopefully at the next board meeting, Coroner Jim Curtis will be doing a presentation. And that's all that I have.
Thank you, sir.
I have a question for Ryan. The spotlights that you'll be doing, will you be letting us know what program you're going to discuss at that meeting
Yes,
on the
so we
agenda?
will, yep, we'll let you know. It'll be on the agenda, and we'll also send out any presentations beforehand so you can review it before the meeting.
Thank you.
Any further questions? Hearing none. Dr. Barg. You're on mute.
Sorry. Good
There you
morning.
go. Thank you.
I want to share my screen for the little slideshow. All right. Hang on one second. Yeah, please.
Always fun, isn't it?
Yeah, the Zoom app disappeared.
I'll be in one of your.
Okay,
So hit share screen.
got it.
Okay, and then you gotta hit share. Perfect.
All right, can everybody see?
Yeah.
Okay, so today's talk, which it was asked for by a couple of the commissioners regarding vaccines, natural immunity, and also available medications coming down the line for oral antiviral treatment. So if people don't know what this is, it's Ford versus Ferrari, and they're both great cars. And I hope to convince everybody that the science now, and always has been, that vaccines and natural infection will confer immunity. So here's a slide that I won't go through step by step because it's very complicated and shows the immunology, but I want you to focus over here. Here's the coronavirus, the whole molecule or the whole virus, and here's the spike protein, which is generated by the vaccine that's administered for the Pfizer and the Moderna. So these molecules are taken up in a macrophage, and then the material that results after digestion is presented to the immune system through a dendritic cell. It's just one of the naturally occurring cells, and eventually makes its way to the CD4 cell, which is the policeman of the immune system. And the CD4 cell communicates with various modalities, and eventually you end up with a plasma cell, which makes antibodies. And those antibodies then attach to the virus back here and prevent it from infecting other cells over here. Okay. This is just so you get an idea of what's going on in the immune system, a level of complexity. But the really important take home is both the vaccine spike protein and the coronavirus go through the immune system in the same pathway. This is what happens once the immune system's triggered. Early on in infection, there's a great response with antibodies, but then that tails out over time. And you can see about 6 months, things start to drop off quite a bit. And it's generally thought that natural infection and immunization both give you good protection for about 6 months. Other components of the immune system remember what's happened and can be re-triggered if they're re-exposed to the virus. And just how many months after infection or vaccination it goes, they're still working on. Other coronaviruses actually induce similar antibody responses, but they fade enough so that we can keep getting infected with the same coronavirus years later, but the severity of infection is much less. So natural infection immunity versus vaccine immunity. What's better at protecting against reinfection? So there is an arm of the immune system called innate immunity, and that's the one that acts without any previous exposure. That's going to be variable in people. Some it's strong enough that you get mild illness, some it's not very strong at all. So you get severe illness. There is natural immunity that occurs after COVID infection. There's vaccine-induced immunity, and then there's immunity that occurs from infection plus the vaccine. So after exposure to the immune system, there's a number of communicating molecules that are produced, and not all of these may be produced at the same level in all people. And that may be responsible for the variations in response, among the reasons that you might have great response to a vaccine, a great response to natural infection or not. I won't go over these. I just want to show you there's a large variety. So one study that was recently published was called the VISION study. And they looked at people who have been previously infected versus people who have been vaccinated, and how much protection there is against future illness. This study compared the level of immunity afforded by the vaccine versus natural infection by looking at antibody levels. The results of this study suggested that the vaccine vaccine immunity is about 5 times more effective at preventing hospitalization than a previous infection. So what it says is you're less likely to get severe disease if you've been vaccinated versus if you've had natural infection, but both protect. So the CDC analysis of 96 peer-reviewed published references show that there is protection against infection with SARS-CoV-2 infection that's natural and vaccination. And some of the details are given here, but for the sake of time, I'll move quickly over this. The vaccine response and the post-infection response are not as effective against Delta and some other viruses. So for instance, Omicron, we don't know yet how the natural versus the vaccine, how well they'll do. One thing that is known though, if the higher the levels that are available in the bloodstream after infection of the antibodies versus the vaccine, that serves as a relative protection against the new variants. So brisk response, an intense response will work out better if variants come around. Many studies have shown that the antibody titers correlate with protection at a population level. So for instance, if all the commissioners were vaccinated and generated high levels of antibodies, you would all be relatively protected, but that's not saying some people might get disease and some people might not. It's just that in general, the population that has the highest antibodies are the best protected. And CDC is, of course, continuing to work on these and keep updated about new variants and responses to vaccines and natural infection. There's another study that was not published yet. It was released to the media. It's not been peer reviewed, but this is an Israeli study that showed just the opposite, is that natural immunity conferred longer lasting and stronger protection than the vaccine. So as you can see, things are still up in the air. So there are different scenarios for protection, and I just kind of simplified them here. The worst level, of course, is unvaccinated. So you're going to have the worst outcomes. If you're previously infected, that would probably be pretty good protection, but we don't know exactly how many months protection wanes. It looks like it's going to be somewhere over 6 months. If you want a little bit better protection, get fully vaccinated. And again, we don't know exactly how many months have to go by before protection wanes, but it sounds like it's about the same. 6 months is natural infection. And really great protection is afforded by if you're a fully vaccinated COVID survivor. And you may only need 1 dose because the combination is so great. And fully vaccinated people, here's the opposite, getting a breakthrough infection. How protected are they against future? We don't know that, but probably the same as getting a natural infection and then getting vaccinated. So as we wrap up the vaccine part of the talk, I have some questions for you that you need to answer for yourself, and I've answered for myself. And they're, what would you do if you never had COVID infection? Would you get vaccinated, or would you wait to be infected and have natural immunity? What would you do if you had COVID infection this year regarding vaccination? What would you do if you had COVID infection more than a year ago regarding vaccination? And what would you do if you were fully vaccinated and had some extra risk factors? Would you get a booster or not? So let's switch gears into medications now. There are two kinds of pills out. There's red ones and blue ones. And each one has a different mechanism of action. It looks like everybody read this book when they were a kid. So the first one that has the most experience is one that's very difficult to pronounce. It's called Molnupiravir. And it's a compound that mutates the RNA that's in the virus. And once that mutation occurs, the virus can't replicate anymore. The most recent studies have shown that in a patient who we know is infected with at least one risk factor, they're down at the bottom: obesity, elder age, diabetes, heart disease, and others, that the administration of this pill reduced the risk of serious infection by 50%. And that data has been just reanalyzed, and it actually looks like it's about 30%. The difficult thing about this medication, it must be administered at the earliest sign of infection, and that's not an easy point to identify. So within the first 3 days or so, which is very similar to the influenza drug oseltamivir. It works best very early on. And some people just think they have a cold. They don't know they have influenza. They don't know how they have COVID until they get tested. It looks like it's going to cost about $700 for a 5-day course. That's 2 capsules per day for the 5 days. That's more expensive than oseltamivir. There may also be safety concerns about it because it could cause mutations in human cells, potentially. So getting the medication early is really the most difficult part of dealing with this. And as time goes on, bigger studies are done, we'll know exactly how good it is at preventing infection in high-risk patients. So the study that's been done was in almost 800 patients. 385 patients received the new drug. 28 ended up being admitted to the hospital. And all those that received the antiviral had survived at the 29-day study period. So good. Of the 390 that got the placebo, 53 patients were admitted to the hospital, and 8 of the placebo group participants died. So it's very, very exciting. Another study also showed activity against Delta. But one thing to be aware of, this is a very small study. Compared to, say, the vaccines, which have been tested on hundreds of thousands of people, we only have about 800 so here. The second drug that's available is a protease inhibitor. This is often given with another drug, ritonavir, and Sean and David may remember that's also used in HIV. What that drug does is just boost the level of the protease inhibitor by blocking its metabolism in the liver. This is intended for non-hospitalized patients with mild or moderate disease and a risk of progression, similar to the previous pill. And this also has to be administered early in the course of the disease. The preliminary data shows that it also reduces the risk of hospitalization and death. However, it may have GI side effects. The treatment course is short, and the studies have all been very small to date. So we'll keep you updated. More news to come. So this slide, I just want to illustrate that everything's variable. So if we look at the top triangle, COVID infection ranges from severe disease to asymptomatic disease. And the result after infection could be very low level antibodies to very high level of antibodies. And we don't know how to tell, aside from doing a series of antibody levels, who's got the high levels and who doesn't. You have to physically test them. There's no way to prove it. If you get vaccinated, some people have a low antibody response, for instance, transplant patients, and some healthy young people will have an exuberant response and get lots of antibodies. And then lastly, if you are vaccinated after you get infection, you even get higher levels of antibodies and presumably better protection than either the vaccine or the natural infection alone. So the protection against natural, after the vaccine or natural infection will vary by a number of parameters. One is age. Older people don't respond as well as younger people. Underlying medical problems, diabetes, obesity, hypertension, heart disease, chronic lung disease, all of those will weigh into how good the response is. The degree of exposure, so high viral burden of exposure versus a low could determine a level of disease. And then finally, the virulence of the viral strain. And if we're lucky, Omicron won't be as virulent. So final words. And then for an infection like COVID, which, well, not like COVID, sorry, like HIV, which does not induce natural immunity, effective vaccines are difficult or impossible to construct. And after 50 years, we still don't have an effective HIV vaccine. COVID infection does induce natural immunity, so the vaccine works well. However, we don't really know how long immunity to COVID infection lasts with the vaccine or natural infection. Immunity to other COVID types, like I said earlier, does not last that long. So at some point, we're going to be unprotected, relatively speaking. No currently available antiviral or antibacterial works as well against infection as an effective vaccine. So prevention, always better than treatment. And then the questions of Omicron. So what confers the best protection? Maybe a combination of styles. And then you can go anywhere if you have the SUV of protection. So that's the end of the talk.
Thank you very much. Any comments or questions for Dr. Barg?
I'm just wondering if, like with are the requests that this information from Dr. Barg will be forwarded to us, because I don't remember seeing it come across. I'd appreciate that.
Yeah, Mayor Byers, I just want to say things have been a little crazy in the hospital, so I couldn't get it done enough, but absolutely, I'm going to send off. I also have another manuscript I'm going to send off. It's from the CDC, and the title of it is SARS-CoV-2 infection induced and vaccine induced immunity. It's a nice summary and really gives it a good airing. I do want to say that I didn't find any information anywhere that mentioned that natural immunity from previous infection isn't effective. Every paper I read recognizes that it works.
Thank you, Dr. Barg.
Thank you, sir. Appreciate it.
I would just like to express my thanks to Dr. Barg. I know it takes some time for the preparation that it takes for you to get ready to educate us during these meetings and answer questions. So I just thank you for your thoroughness of your approach. That's all.
You're quite welcome, and I know this is going to lead to more homework assignments.
Dr. Barg, I have one question. One of the findings, I believe, with these antiviral drugs is they do not seem to benefit those who have antibodies. So those who've been previously vaccinated or infected. And I was wondering if you could comment on why that might be.
Actually haven't come across that particular data, Sean. I can postulate that if there's antibodies present, that they're going to work better than the antiviral. And that may not be the case for future antivirals that are stronger. I think it's just because these aren't particularly effective to say like antiretrovirals are for treating HIV.
Thank you.
Dr. Barg, I would just also like to say thank you. This has been very nice to have a balanced approach, and it's nice to see for the first time some acknowledgement that natural immunity does confer protection against the virus. And knowing that we have, I think, short of 47,000 people in Yakima County who have tested positive, I believe the CDC still states that for every person who's tested positive, there are 4 people who had the virus but did not go get a test, which means that, we're well over 200 and some thousand people in Yakima County. I believe 250,000 people in Yakima County potentially have natural immunity. We're a population of 278,000. Factor in our high vaccination rates, and there is a lot of immunity in our community to at least make sure that if someone's infected with COVID, either reinfected or has a breakthrough case, that they're going to experience mild symptoms, because I believe that puts us over the 8 and could be more potentially with those numbers who are vaccinated. So it's welcome news, obviously, to see the acknowledgement of natural immunity in our society.
That's the goal.
Commissioner
Dr.
McKinney,
Barr-
I'm not,
Dr. Barr, two comments if I could. Oh, sorry.
no, after you, please.
Two comments. First of all, nice job presenting a difficult and technical concept. I've never been able to pronounce any of those retroviral medication names. So I'm always impressed when I hear it. I'm like, oh yeah, that's how you say that. So they're just really a mouthful of letters and challenging. The second thing I would say is congratulations to the Michigan Wolverines for their dominance over Ohio State this last weekend.
Okay, well, is there any other comments? Questions?
Yes, I'd just like to share, Commissioner McKinney, you were talking about the acknowledgement of natural immunity. I don't think anyone's ever dismissed the value of being naturally immunized, but I think it comes at a great cost. It's a tremendous, tremendous gamble to become ill with something that potentially could kill you or hospitalize you, or also allow you, unfortunately, to transmit at a higher rate to other people. So it really does come down to the issue of safety and protection. And as Dr. Really, I mean, I guess Dr. Barg said it best when he said prevention versus getting the illness in the first place.
Director Fresco, I understand what you're saying. What I'm saying is that we do have people who have already had conferred immunity now, and our policies are not reflective of acknowledging natural immunity. So we have vaccine mandates going out across the state for employees without the benefit of acknowledgement of natural immunity. And that's why, so we can say that we're now acknowledging it, but our policies don't reflect it.
I think the hard part is knowing what to do with the group that have natural immunity. For one thing, it's very hard to identify them. If it's been more than 6 months, they won't have circulating antibodies. So you can't prove that they actually have any residual immunity. But there are countries that are doing things that recognize natural immunity. In Germany, they have, what they're referring to as the 2G policy, which identifies people who have had natural immunity due to an infection within 6 months and 28 days. So if you've tested positive by PCR more than 28 days ago, meaning now you've cleared the infection, but not more than 6 months ago, which would mean your response is waned, then you're considered immune. And you essentially have the same immunity in their eyes as somebody who's been vaccinated. The unfortunate thing is you are recognized for that for 5 months. And then in order to obtain those same rights under the 2G policy, you would have to get infected again. So it is a cost, as Andre said, to have to be repeatedly infected in order to maintain natural immunity.
Thank you. Any further comments? Thank you. We will move on to Melissa Sixberry.
Good morning, everyone. I'll start off with our Rsd and Flu numbers. Jocelyn, I believe you were going to pull that up for me to show the graph. Our activity across the state and the county for influenza is low, minimal across the state. And then we are seeing some activity in RSV. So this graph here just shows over the last 3 years. The gray line is the current year, what's going on. The blue one on the bottom was, of course, last year with all of the measures that were in place and the mandates. So we really didn't see much of RSV. And then, of course, the orange was the 2019-2020 season. So we are seeing an increase in our RSV in the community. We have had no new TB patients since our last Board of Health meeting. And we are working with, there was a large group of individuals that had potential exposure. So we are working, our public health nurses are working with the Indian Health Services nurses. We've gone out, we'll be going out for the second time tomorrow to do TB testing, COVID vaccines, and influenza vaccines to those groups that are at high risk down in the Toppenish area. And I think that's about it for me, unless anyone has any questions.
Melissa, are those positive RSVs a cluster, or are those just sporadic cases popping up around the valley?
Just sporadic cases, and these are the ones that our surveillance only includes hospital data. So it's people who are seen in the ER. So it's not anything from outpatient.
And do you have any idea as to how these patients may have interacted with each other, or you think that they're completely unrelated?
I don't have that level of data. We just get the reports of how many they tested that week and how many were positivity rates.
And then finally, is it typically children still seeing this, or?
Quick question, Melissa. Since these are, like for 21, 22, are the numbers at the bottom indicative of the week of the year?
Yes,
Okay.
exactly. So they go by CDC week.
Great, thank you.
So just to clarify, Melissa, that means we don't have any data past week 48, right?
Right.
For this year.
Correct. So, and I'll be working, these are some old Excel programs that we've been using, and now that we have a great epidemiologist, I'll be working with her to get these in a better format, because these numbers are also posted on our website. We update those weekly. The providers within the community use that to see what's going on within the community. So.
Okay, thank you. Is that the conclusion of your report?
Yes.
Okay. We'll move on now to Mr. Sean Mcgee.
Good morning, everyone. We are at the tail end of our busy season in EH. We still have decent weather and not too cold temperatures out there. So we're seeing our late fall, early winter uptick in land development programs. People are scrambling to get their projects done before the ground freezes and the snow falls. So we're working hard to get those permits wrapped up for community members and allow people to move forward with their building permits and such. But once the weather really takes a turn for the worse, we'll see our drinking water and on-site programs really slow down, which gives us an opportunity every winter to really focus on our food inspections and try to get the bulk of those done throughout the winter months to lighten the load for late spring, summer, and through the fall when our land development programs pick back up again. So we're wrapping that up. We've seen a lot of movement from the State Department of Health on some new Washington administrative codes that are being written. I believe the new retail food code begins in March, and we possibly have a new on-site sewage code beginning in July, taking effect in July. So I've been in DOH meetings regarding those two new administrative codes to determine how that may affect and change our processes here locally, so we can be prepared for that and have everything in place to keep our programs operating smoothly. Really, the major changes I see coming is food banks. Now, as of right now, required to have a retail food permit. However, in the new food code, they are exempt from permit, but still must follow the rule. So our plan for that would be, we have a operation plan submitted by food banks to go over how they're still meeting food safety regulations. However, they don't have to purchase apply and purchase a retail food license from the health district. So changes like that are coming that we'll have to make some adjustments to our processes for certain businesses. And then, as you know, we do have some newer staff on board in environmental health. So we're continuing our mass training efforts to get all those folks up to speed and ready to go. We start those folks out with training in the food program because that's our most consistent busy program, every month out of the year. And then we'll be expanding them into the land development programs such as drinking water and on-site once they get comfortable in food. So we'll keep making progress there. And that's all I have for you today. If you have any questions,
any questions for Sean?
I do have a question, Sean. Could you just speak at least anecdotally to the land use aspect of your business and where you're at now versus what happened during COVID and pre-COVID as far as response, so turnaround times for the land use inspections that you're having to do. Could you just give us an idea? Are you caught back up? Are the turn times where they were pre-pandemic? If you could just give us an idea, please.
Oh, yeah. So yeah, during the I guess the most shut down part of the pandemic, during the most restrictive months of the pandemic, our response time was a little longer. We were working remotely. There was a lot of different requirements that construction crews had to have on site that we had to ensure were there, such as a COVID plan that's posted, the social distancing aspect of that, which can complicate an inspection, especially in a restaurant. But in land development, when we're all trying to look into a new septic tank to determine if the alarms and pumps are all as they should be, typically there's a couple people huddled around there. So we had to adjust our processes. And we were still getting out there and responding to folks generally within a week, which is about the same as when we're conducting business normally during the busiest parts of the season. There might be a week or two during the busy season where that gets extended to 10 days. Just it's all dependent on how many applications we get, any given day or week. Right now, our response time is typically less than a week, unless we get a real complicated land development case where we have to make multiple site visits to come to a solution for our applicants. But typically we're less than a week right now, and that's what I'm seeing so far. With restrictions being less, our staff are still masking up out in the field. However, those restrictions are different for operators. So it's a lot easier to just show up and do the job without having to take into consideration all the different restrictions that were in place before. So we're minus having the newer staff that aren't quite trained up yet. We're full go for going out in the field and getting on site with our septic designers and installers and property owners to figure out what they need. But yeah, we're seeing a pretty typical response time for this time of year right now.
Thank you, Sean. And I would just offer up that when we're talking about potential things to talk about to expand our knowledge about what the health district does, the land use aspect would be particularly interesting to a lot of people because it does have a lot of impact on our housing market and development. And I think it'd be quite interesting as a topic for the coming year.
Yeah, well, the spotlight presentations will be a perfect opportunity to talk about our land use program.
Yes, and if I may add to, thank you for the question, Commissioner Mckinney, because really what Sean is talking about is the fact that we're responsive to the needs of industry. And so, and also landowners specifically. So it is reactive based to the needs of what people are interested in doing. So it's not just cyclical in terms of seasonal work, but it is really dependent on how many people require assistance at any given time. And that really is a courtesy-based approach that we take. But that will be certainly a wonderful opportunity to discuss in our spotlight. Thank you.
Okay, thank you. Any further questions? If not, we'll move on to Miss Lillian Bravo.
Yes, good morning, everyone. So I'll start with a few updates. A few of these things I mentioned in our last meeting, but I just wanted to give you some updates on how it's been going. So the first being the campaign, our developmental disabilities campaign, the one titled I Am Able. So just a reminder, it highlighted a few of our Yakima County residents that are in our developmental disabilities program who are currently working in the community. I'm not sure if you've seen it, but here's a little example. Here's we had billboards, we had social media posts. I know I've been watching YouTube. I've been seeing the videos there. So it's received very, very well from our community members here in Yakima, but also I'm happy to say that it's been very well received statewide, and it's actually being considered a best practice through the Washington State Developmental Disabilities Administration. So definitely congratulations to the team, and we're very excited to see that it was received well, both in our community by people who recognize our members of our community, but also statewide. And then also an update, as I mentioned last month, that we had been working with several different schools, migrant programs, different clinics, even some of our managed care organizations here locally to host community flu vaccine efforts, where we were also able to provide COVID-19 vaccine for those that were eligible. So through those efforts, we were able to vaccinate over 500 individuals in the last month and a half. And it's been very, very successful. We even had Columbia Valley Fruit that donated several boxes of apples to some of these events. And of course, that this was all done in conjunction with the school districts, with families, and making sure that everyone was caught up to date with both routine immunizations and if they were interested in getting the COVID-19 vaccine, that was available as well. So I just want to thank all the partners that work with us, just a few being Yakima Neighborhood Health Services, Swafford and Halma, Columbia Safety, Highland Community Clinic, Sunnyside School District, West Valley School District, Yakima School District, EPIC, Inspire Development Migrant Program, and as I mentioned, all of the managed care organizations that serve Yakima County as well. And then another update, just a reminder that if anyone is interested in getting more information from our staff, we do have community health specialists, which are Yakima Health District staff that are available to go out to different organizations or even employers. Just as an example, Borton Fruit Company reached out as wanting more information for their employees in conjunction with the vaccine clinic that they wanted to offer voluntarily for their employees. We were able to present to them in 9 separate sessions for their workforce. And those presentations were well received, and with many employees expressing interest in either starting or completing their vaccination process. So if there's any organizations or employers that are interested in doing something like that, please let me know and we can make sure to have that available as a resource for the employer or the community organization as well. So that's the updates that I have. I'm happy to take any questions. Thank you.
No question? Go ahead. Go ahead, whoever was going to speak.
I don't hear anybody else. I'll just say Lily and I have been seeing the disabled pieces of education on social media in our community, and it's been great to see that, and I appreciate it.
Any further comments or questions? All right, well, hearing none, we will move on to unfinished business. Mr. Andre Fresco, please.
Yes, thank you, Commissioner Anderson. So one component of unfinished business was the future discussions about scheduling our upcoming Board of Health meetings. As you know, we have our regularly scheduled board meetings once a month, but we have our special board meetings as well. We anticipate our next one being the 16th, December 16th at 5:30 for a 3-hour meeting. That is the time that worked well for everyone. This fits appropriately, considering we should have a lot more information to discuss with you on the Omicron variant by then. I think it'll be fast moving, so that's helpful. Unless we don't have agenda items or the board wishes not to have it, we're anticipating having that meeting on Thursday, December 16th at 5:30. Additionally, we know that the board has had, some board members have had conflicts with the meeting times on Wednesdays, and so we did poll the board to determine what the best day would be to meet, and so it was determined that the second Thursday of each month for a special board meeting in the evening, 5:30 to 8:30 was the best possible solution. So that is our direction, and we anticipate doing that in future months. And I'm happy to entertain any questions.
Any questions, comments?
Very good. That's all for me, Commissioner. Thank you.
Thank you, sir. Next is Mr. Elliott giving us an update on OSHA.
Just to follow up on where we were at the last meeting that we had, we were waiting to see who won the lottery. It turned out to be the 6th Circuit. As we had mentioned before, the 5th Circuit Court of Appeals had issued a stay that was placed related to OSHA's enforcement of this one was focused solely on the 100 employee vaccine mandate. It's important to understand there are actually 3 different federal vaccine mandates that are now out there. One was the 100 employee one. That's the one we've been talking about. There is a separate one related to federal contracts where an employer has a federal contract. There is a vaccine mandate for that. There is also a vaccine mandate that has been placed out related to healthcare workers. Just so we're clear on which one we're talking about in this regard, this is the 100 employee vaccine mandate challenge only. The other two related to both the healthcare worker vaccine mandate and the federal contractor vaccine mandate are separate than what I'm about to discuss now. To the extent there are any questions about those other two mandates, I can also do my best to try and answer those questions. Where we left it last, the Fifth Circuit had made a decision that essentially identified that OSHA needed to, for lack of a better term, stand down in the enforcement of its action. After that decision, the lottery took place. The Sixth Circuit now is going to be the circuit that decides this for the whole Court of Appeals across the United States. They have options about what the Sixth Circuit can do. But before I get into those, I will say that OSHA, now in response to what the Fifth Circuit did, actually came out publicly and said they will abide by that stand down request, that OSHA will not take any action pursuant to that court order unless and until something is decided at a different level. So as of now, OSHA has said they will follow the stand down order. And now the decision lays in the hands of the Sixth Circuit. And I will get to that in a second. I had also cautioned you that there was an opportunity for the governor of this state, because we are a state plan state as it relates to OSHA, et cetera, that our governor could have made a decision to alter or change the requirements that came from OSHA. His announcement coming out publicly was that he would follow the OSHA mandates as they are. So there is no greater restrictions that he placed on the state of Washington as of this date. So as we are sitting here today, the rule in the state of Washington would be that the 100 employee vaccination requirements would be in effect if the Sixth Circuit makes a decision to lift the stay from the Fifth Circuit. And I don't mean to make it too complicated, but I'll try and keep it as simple as I can. Right now, the stay is in effect. The Sixth Circuit has the ball in their court. They have an opportunity to make a decision what they want to do. Keep in mind that once the Sixth Circuit issues its opinion, I'm not a betting man, but if I were, I would say that no matter who wins or loses, there will be an appeal to the United States Supreme Court. I find it highly unlikely that no one would challenge the decision that comes from the Sixth Circuit. I want to inform this board to the extent that you want possible timelines. I know that was listed on the agenda. The gist of it is this, and this is how it will come into play related to the timelines that are currently in effect. The scheduling order required additional motions in support of OSHA's motion to lift the stay. So the Fifth Circuit issued the stand down. OSHA essentially through the Department of Justice asked for an emergency motion to lift that. The Sixth Circuit allowed anybody else to join in that motion, and those briefs were filed yesterday by anybody who wanted to join. The court has identified a response to those motions as December 7th. That timeline will be important here in just a second. And then the Sixth Circuit required any replies to those responses should be done by December 10th. Also an important date as it relates to where we are. The original 100 employee vaccination mandate required steps to be taken by said employers as of December 6th. Based on this timeline of the scheduling order, I would say that it's very, very likely that what I'm going to call the ETS, the emergency order by OSHA, will continue to be stayed until at least December 10th. I cannot imagine a world in which the Sixth Circuit will make a decision before all briefs are brought in. So to one degree, there will be a delay in terms of the enforcement of what was the December 6th starting point for employers to at least December 10th. Now, again, the Sixth Circuit, they have the ball in their court. They make the decision and they will decide what they want to do with the Fifth Circuit's ruling, whether they want to lift the stay, whether they want to alternate. They have the ball in their court. But also keep in mind that I would say it's very likely that no matter what decision is made by the Sixth Circuit, it will get appealed to the United States Supreme Court. So as it relates to the 100 employee vaccine mandate, that's the law of the land in terms of where we are. Does that raise any questions for any board members?
Where's the location of the Sixth Circuit, James?
My recollection is that would cover Michigan,
Ohio.
Dr. Atterbury, I'm sorry, it's been a while since I was in law school and had to study each of the states, but I know those two are sort of the major ones.
Yeah, it's Midwest. Thanks.
Other questions?
Thank you. Thank you, sir. Appreciate it. All right, we'll move on to new business.
Well, Commissioner Anderson, I interpreted Mr. Elliott asking if there were any questions about what he said thus far. So I would like to ask then if he could go in at least briefly and touch on the other two that you mentioned so that we can get an idea, because as you state, there are three and they all are in play right here.
Yeah, I can do that, Commissioner. I was actually reading this morning. There's one update on the federal contractor issue. Actually, I was reading it. No offense, Dr. Barg, but I was trying to get updated date because I figured I would get this question. So I'm going to focus now on what's called the federal contractor mandate. It is a mandate that any employer or business that has a contract with the federal government, that the federal government has identified certain requirements related to a vaccine mandate in order to continue their federal contract. I know that there have been at least 3 different states, maybe up to 5, that have filed lawsuits. And I kind of want to make this, and I don't mean to get too far into the weeds on this, but in those 5 states or so that have filed these challenges, it is the attorney general of the specific states who have filed on behalf of their states a challenge to the vaccine mandate within their federal courts. I'll explain in a second why that's important. Of those 5 states that have filed challenges, I read a ruling that actually came out yesterday from Kentucky. The Attorney General for Kentucky had brought an action, and a federal judge, which keep in mind is the trial court level of the federal system, so below what would be the Circuit Court of Appeals, issued an opinion essentially saying that as it relates to the state of Kentucky, that those issues should be stayed pending a further determination related to the constitutionality on the federal contractor portion. I am aware of only that decision at any trial court level in the United States. I have not spent a lot of time studying all the federal contractor cases. I will admit it's tough to keep up on all of these, but I'm aware of that one only because it was issued yesterday and I read the opinion this morning. There are others that are out there that have been filed by the attorney generals for their individual states. And the reason why I bring up this important distinction is I am not aware of private businesses that have filed these related to this federal contractor mandate across the country, because frankly, I just don't have the time to keep up on all that. So I hope that you can understand. I try and track it as best I can. I have not seen any filings by any employers in the state of Washington, but again, there are only so many hours in the day for me. I will say it is highly unlikely that the Attorney General of the state of Washington would bring this action on behalf of the state of Washington based on prior comments that Attorney General Ferguson has stated. And so I probably don't want to jump into that too much, but I would say to the extent that anyone in the state of Washington is saying, great, this is going to happen to us, that is a horrible way of interpreting what is going on. And I would caution any employer who has a federal contract to rely on what's going on in Kentucky or any other state. I would essentially say that you would be in a major problem. And so I would advise, as I always do in this area, my job is to try and help this board. My job is to try and help you to the extent that you can guide your constituents, but I'm never giving legal advice to employers out there as a whole. And so any employer out there who has a federal contract, I would recommend you contact your individual employment attorneys to get further guidance on that one. So that solves, or at least in my mind, identifies for you the federal contractor mandate. So because there's a third one, maybe this is a good time for me to stop in case there are any questions on that. Hearing none, I will move on to the last one, which is the healthcare worker vaccine mandate that exists across the country based on OSHA and based on the president's executive or identified executive order. Keep in mind, our state already has a healthcare worker vaccine mandate issued by the governor that, if I remember the dates right, went into effect as far as requirements in the middle of October. So this one really doesn't have any effect on the citizens for the state of Washington. So any questions? Overall, welcome to the legal world. It's lots of fun.
It's good reading when you can't sleep.
Thank you.
All right, well, thank you, sir. Appreciate it. We'll move on to new business, the proposed motion. Mr. Ryan Ibach is going to be presenting.
Okay, so in December, our executive director, Andre Fresco, is due for his performance evaluation, which was done in an executive session at the beginning of the meeting. And he's also eligible for a salary step increase of 3%. So there is a proposed motion on the agenda to approve a salary step increase for executive director Andre Fresco. So we just need a board member to make the motion and a second if we want to move forward with that.
Is there a motion?
This is Dr. Cleary. I'll make a motion to approve the step increase for the executive director.
Do I hear a second?
This is Nyla Duval, and I second that.
Been moved and seconded to approve a salary step increase for the executive director of 3%. Mr. Ibach, would you please conduct a poll?
Would you like discussion first or?
Any discussion?
Oh, I'm sorry, any discussion? Yes. Okay, hearing none. Would you please conduct a poll?
Was the motion stated that the step increase was 3% specifically? The agenda doesn't reflect the incremental amount, so I just want to make sure that the motion reflects the incremental amount being proposed.
Yeah, the step increases, they're built in at 3%. So that's automatically that step increase is 3%.
For the benefit of the public, I think it's important that we are specific in notifying them.
Right.
That
Yeah,
the
that was stated. Any other questions? Comments?
Yeah, I'd just like to go ahead and thank Mr. Fresco for his service to the Yakima Health District and his job that was very well done in getting the presence of the Yakima Health District in the Yakima County. It was very good job in his leadership in managing the Yakima Health District staff. Thank you.
Thank you. Any further comment or questions? Hearing none, Mr. Ibach, would you please conduct a poll?
Okay, so if you'd like to approve the motion, which is approve a salary step increase for executive director Andre Fresco, state yes, if not, state no.
Of 3%.
Do we have an amendment to add the 3%?
I'll make an amendment to add the 3% to my motion.
I'll second that.
Thank you.
Okay, so go on to, do you want discussion on the amendment?
Is there we need a poll? We need a poll on the 3% amendment?
Yes, we do.
Yes, we do. Yes.
Okay, so for the amendment to add 3% to the main motion, if you agree, state yes. If not, state no. Dr. Cleary.
Yes.
Commissioner McKinney.
Yes.
Commissioner Lindy.
Yes.
Mayor Byers,
Yes.
Councilmember Duval,
Yes.
Dr. Atterbury,
Yes.
Commissioner Anderson.
Yes.
Okay, so the amendment approved 7-0. And then move on to the main motion, which is now to approve a salary step increase of 3% for Executive Director Andre Fresco. If you approve, state yes. If not, state no. Dr. Cleary,
Yes.
Commissioner McKinney,
Yes.
Commissioner Lindy,
Yes.
Mayor Byers,
Yes.
Councilmember Duval,
Yes.
Dr. Atterbury,
Yes.
and Commissioner Anderson.
Yes.
And the motion approved or is approved 7-0.
Thank you all. Appreciate it.
Thank you. And the Fresco family, thanks you.
We will now move on to item B, update of the Yakima Health District Situation Report to include year-to-date data, and Commissioner McKinney.
Yes, thank you, Commissioner Anderson. So we are approaching now the 2-year marker on this pandemic. And I know that there's a lot of discussion in medical circles and the media about it becoming endemic. And I think it's important for us, Director Fresco, you said earlier in the meeting today, your comment was that you wanted to acknowledge that there was going to be anxiety. And I think a lot of anxiety comes from the fact that we are looking at all of these numbers that are compounded over a 2-year period. While they are real and we need to acknowledge the extent of the impact of COVID, which has been severe to our community and across the United States, I do think it's important to have perspective and context. So what I would appreciate and what I'm proposing is that our situation report as of January 1st also show what our year-to-date numbers are. So that we can differentiate and know what the effects of this virus are on an annual basis, which is typically how we track things that are impacting our community's health. Death rates for various items are always done that way. So I'm proposing it and would ask for discussion, but my motion is to ask that the health district staff include a year-to-date going forward on the situation report, in addition to the rolling numbers that are continuing to be reported. Thank you.
Any further comment?
So for clarification, Commissioner McKinney, is so on our situation report, we do list cases, hospitalizations, and deaths by month. So there's something in addition you would like. So you like just those totaled up?
Yes, so on the very first, the largest chart that we have that shows our cases that are broken down by age groups for the numbers for each age group, for example.
Okay. Okay. And that when you state January, are you stating starting this coming January 2022 or retroactive back to January of this year? You want to see the numbers?
No, I think I'm not looking to try to create more work. I think that just going forward January 1st, if we could have that column added as well.
Okay. Is there a second to the motion?
Second.
Been moved and seconded. Any further discussion?
Yeah,
Maybe Melissa can answer this. Are there any other departments that are reporting their data in this manner that we can kind of follow their guidance?
I don't know of any. I could reach out to other counties and see how they're displaying their data.
If I could also add, typically when you're dealing with a response initiative like we're dealing with, it does begin at the inception of the response. So as you said, Commissioner McKinney, we would want to still maintain our totals because I think it's necessary to show, because that's how we track disasters essentially in public health. But also recently we had our worst month in terms of the tragic loss of folks in our community in September. So I don't want to lose sight of the fact that this is still a very real issue for us. But we can certainly do some research and get back with you.
Director Fresco, I'm not saying that it's not certainly something that's had a negative impact. I thought I made that clear in my statement. I'm simply saying that it's important for us to put this virus in context to the fears and anxiety that it's causing, and that we need to look at what the impact is on our mental health, how we conduct ourselves on a daily basis. So I would appreciate it, and I appreciate the welcome conversation on your part, but I would welcome any more board input if needed.
Well, I think it's been very useful having the monthly trends so that we can kind of see how things change from month to month. So adding additional points, I don't think is get rid of any of our current statistics, but if you want to add, you know, how many deaths or hospitalizations there were for 2020 versus 2021, it will also show a trend just as the monthly data does. But I don't know how that's going to reduce anxiety if you're adding more numbers to what we're looking at.
Personally,
Go
I
ahead.
like graphs better than raw data, but that's just because I'm a visual learner and I interpret the data better. But nonetheless, I mean, I think whether the data is there in months or the data is there annually or both, I wouldn't change how I view it. It's data.
I can say on epi curves, it does show the trends month to month over the whole pandemic, where you could see where we had our waves, and I think it's the same thing as the, you know, just the graph of the raw data.
Any further comments?
Just a
No,
question.
Go ahead, Commissioner Lundy.
Oh, okay. Thank you, Mayor Byers. Just a quick question. So when we're talking about having year-to-date data, are we talking about all the data that's already being produced, or are we limiting it to things like total cases or infections, hospitalizations, and deaths?
Our situation report is limited right now to COVID cases, hospitalizations, and deaths.
So really what we're asking then is we would just we're already compiling all that information on a month-to-month basis. We would just be adding an extra column where we're also putting the year-to-date for that information that we're already compiling. Is that am I understanding that correctly?
That's correct.
But we're doing that for the entire population. We're not trying to break that down also for each age group and such.
Well, we would be able to do that, Dr. Cleary, because that first graph already shows that. And so when we show, for example, all the test results. So right now we show a rolling number of almost 47,000 positive tests, and those are broken down by age group. So I'm simply suggesting, for example, that the test positivity for age groups on that first chart be demonstrated in a year to date, as well as overall, as it already states, for the time that we started testing for the COVID virus.
And again, what was the value in that?
The value, I find
Yes.
the value to be showing what the impact is on an annual basis. Right now, we're looking at numbers that are compounded now for almost 2 years. And if Omicron and the next variant comes out, we'll be looking at various variants for years and years to come. So it's important. And I think we're going to be hearing from our coroner. We want to reduce anxiety, and reducing anxiety is talking about what the threat level is. And right now we need to compare it and put it in context to what other things we also track on a yearly basis, such as deaths from overdoses, suicides, domestic violence, car accidents, you name it, the gamut. So we need to be able to put that in context. And I think it will be helpful for people to see what the impact on the virus is on our community related to other things that we similarly track on an annual basis.
Okay, and is that January to December, or is it from when the pandemic started and we started testing? What dates are you looking at?
Again, beginning January 1st to run through the calendar year.
Okay.
Starting January 1st, 2022.
Any further comments, questions?
Well, I would suggest if we're going to compare 1 year to the next, we should have the yearly statistics for the previous 2 years. Because if the whole point is to see what it is per year, then we should have the data since the start of the pandemic, or that January, and be able to compare each individual year.
I think it's a great idea, Dr. Cleary.
That makes sense.
Yeah, I was actually going to suggest that myself, so I'm glad you brought it up. I know it'll be a little extra work initially, but once those first 2 years are figured out and put into place, we'll then be able to do the accumulated year-to-date total that Commissioner Mckinney is asking for, and I think that'll be helpful. So thank you.
Are we looking for something similar to the graph that I showed earlier on our RSD that shows the difference between the 3 years?
I think yes, Melissa, or anything quite that makes it easier for you. Again, recognizing, as Mayor Byers just said, that this is going to be a little bit of work up front. Well, not to trivialize it. It's going to take some time. Or welcome whatever is going to make it easier for you to compile the data. And to Dr. Atterbury's point, visually, if you want to also inject a graph, but always have the raw data open to whatever works best for staff.
Commissioner McKinney, I think this also hits on something else. If we're going to look at this in terms of years, the recognition, as you said, that this has been a very, very long time for the entire community. And so having a reference point of when this began, when certain things occurred, when vaccinations occurred, I think it could be helpful. Thank you.
Any further comments or questions?
Do we have a motion in place?
Well, we have a motion. I was just kind of waiting to see.
Would you read the motion, please?
I can restate it unless, Ryan, did you happen, were you keeping track, or would you like me to restate?
Yeah, could you restate it, please?
Absolutely. I motion that we ask staff beginning January 1st, 2022 to reflect in our situation report year-to-date information in Yakima County for COVID tests, cases, hospitalizations, and deaths.
Okay. So if you approve the motion, please state yes. If not, please state no.
My question is just, Ryan, do we need to make an addendum to the motion to include the summaries of the last 2 years?
We would need to, because I didn't state it in my original motion.
Would you make a friendly amendment to that then?
I would make a friendly
amendment to my own motion, but Mayor Byers might.
Yes,
I'm sorry, that's who I was.
Yeah, I would make a friendly amendment that in the initial report, we include for comparison, the total annual in each of those category for the years 20 and 21.
Commissioner, would you agree to that?
I do.
Who made the second?
I believe Mayor Byers made the second. Oh no, Dr. Atterbury, yes.
Dr. Atterbury.
Yeah.
Doctor, are you agreeable to that amendment?
Yes, I am.
Thank you. We need to conduct a poll on the amendment and then on the original motion.
Okay, if you'd like to approve the amendment, then vote yes. If not, vote no. Dr. Clary?
Yes.
Commissioner McKinney?
Yes.
Commissioner Lindy?
Yes.
Commissioner Byers?
Yes.
Mayor Byers, sorry.
Okay.
Council Member Duval?
Yes.
Dr. Atterbury?
Yes.
Commissioner Anderson?
Yes.
All right, the amendment 7-0. And now for the main motion, which adds the amendment, Dr. Clary?
Yes.
Commissioner McKinney?
Yes.
Commissioner Lindy?
Yes.
Mayor Byers?
Yes.
Council Member Duval?
Yes.
Dr. Atterbury?
Yes.
And Commissioner Anderson?
Yes.
All right, the main motion vote is 7-0.
Thank you all. Appreciate it. I know it's going to be some work for staff, but I think it'll be very valuable in the coming months and years. Thank you. We'll now move to item C, which is discussion on the booster shots and antiviral COVID-19 pills. Commissioner Mckinney, tried to give you a degree, but I couldn't.
That's okay. I have two, but not doctorates. Thank you. Well, I really enjoyed Dr. Bard coming forward with the presentation, and I wanted to make sure, I know that Victoria had forwarded on, there were several topics of discussion listed here, and I had forwarded some links to different articles that appeared in the Washington Post, the British Medical Journal, various articles regarding studies talking about naturally acquired immunity, and really directed towards quite frankly, as Dr. Cleary has already stated, that there are policy differences across the globe as to recognizing natural immunity and also in children. Most specifically. And I know that we had a letter that was addressed to us just this morning that was read from a parent who was excited to have her 5-year-old vaccinated and protected, which are, you know, it's a blessing that we have that available in our community so freely for those folks who are choosing to do so. And I was pleased to see that she was proactively asking for changes or reconsiderations in our policies for how we react to new known data and science, and especially when it comes to natural immunity. So I would say, I just thought it would be very interesting to start a conversation. I think it's something that has unfortunately been lacking, is the acknowledgement that natural immunity is something that does provide protection. The length of time certainly is up for debate still, as is the length of efficacy for the vaccines. And unfortunately, I think to Andre's point about anxiety, we're causing a lot of anxiety in our society by labeling people who are unvaccinated as though they were carrying the plague. And that somehow they pose an immediate threat to the public health, which is something that has been stated by this health board over the last 2 years on several occasions. And I think it's important for us, as our understandings evolve, to acknowledge that people who are unvaccinated may very well have greater protection against the virus than those people who are vaccinated, depending upon what vaccine they chose and when they got the vaccine. So I would like to foster a dialogue where we can be more accepting of understanding that it is a personal health decision, because only an individual and their doctor know what their personal health profile is. And so I just would welcome any conversation if anyone has anything to discuss based off of the articles that I forwarded, or any other that you feel like you'd like to contribute to the conversation. Thank you.
Thank you. Any comments or questions?
I would like to say that for people who have acquired natural infection, at the population level, there's going to be a lot of them that are actually safe from getting reinfected, but there's no way to identify those people. So if they had it and they get a vaccine series, 6 months or more afterwards, then they'll be protected for an even longer period of time. So they can prove they've been infected because they'll have a positive test. But the question is, how long will they be protected? And somebody at some level has to make a decision what that time's going to be. And I think it will be made as more data becomes available.
I would just add from a personal perspective, because I think it's important, as somebody who had COVID, got COVID pneumonia, stared death right in the face, life and death situation, the vaccine is much easier. And when I hear people talk about the vaccine or the troubles they had with the vaccine, I had the vaccine after I had COVID. There is no comparison between the peril of the two. And any worry to that extent, I think, is grossly overstated. And it's much easier to get the vaccine. It's much safer. You're much less likely to die. And therefore, I would say, I know it's a personal health choice. I agree with that. I don't agree with mandates, but I would say from a personal story, my own, getting the vaccine is easier than getting COVID.
Thank you.
I would add something, and I'm hoping that perhaps Dr. Barr can address it. I do understand, and this is from the very beginning of this disaster, we have had the friction between personal health and community health. And one of the basic tenets of our work in public health is when you have a communicable disease, a disease that can transmit, and certainly a disease that is deadly, there is a concern that the choices that people make individually impact the collective community. So while I know that the idea is that once someone has COVID, if they acquire it naturally, they may be more protected, if you will. The process of becoming ill is not only dangerous to them, but the ability for them to shed a deadly virus to others is also very, very concerning. And so it is a deadly transmission potentially for others. It can land people certainly in the hospital. It can kill people. It can certainly affect their health long term. So I would hope that when we're talking about the process of natural immunity, we also accept that the process of getting to natural immunity is itself very dangerous, both for the individual and those around them. And I'm hoping that Dr. Bard can at least address the issue of the reality that you are more likely to spread if you're unvaccinated.
Yeah, that's definitely true. You're going to have more virus around. You're going to have it around for a longer period of time. So it's just easier to get vaccinated. You know, vaccines actually have eradicated smallpox. Took a long time, but I mean, there is no smallpox because people get vaccinated. That's not going to happen with coronavirus because you get reinfected downstream, but the infections won't be as serious. So we're still in the middle of the buildup to having enough people either having it, acquired it naturally, or getting vaccinated. So we're still going to have cases. By the way, I just got a flash that Omicron was detected in California.
Okay. Well, it can stay there. All right, well, thank you much. Is there any other, that concludes our business that's on our agenda. Any further business that we need to address? Hearing none, I will entertain a motion to adjourn.
Mayor Byers, move to adjourn.
Is there a second?
Dr. Cleary, I'll second.
Been moved and seconded to adjourn. All those in favor?
Aye.
Aye.
Say aye.
Aye.
All those opposed? Thank you very much all for your time and comments and input. We are adjourned.
Thank you.
Thank you very
Thank
much.
you, everyone.
Thank you.
Thank you, everyone.
Here.